Greetings, my dear friend. And he's your friend, Professor Edin Dibuago, Professor of Public Health Medicine. We're still talking about cancer of the cervix. We're trying to get information about the things you can do to avoid, being afflicted with cancer of the cervix or dying from it. In this episode, we are going to talk about the effect of this cancer on your sexuality and fertility. We're also going to talk about the common myths and misconceptions people talk about this cancer, so that you don't fall victim to this erroneous information. Let's talk about the effect on sexuality. Of course, if you let cancer of the cervix be full-blown, the effect on sexuality is obvious. It's going to have very adverse effect, because if the lady is having discharge, having foul-smelling vaginal discharge, having pain on having intercourse and all that is a problem. You can't fully, have sexual intercourse happily. You can't enjoy it. And so mainly the fact that he has that problem and he knows the stage is bad, psychologically will be turned off. Again, some of the drugs you use for this treatment, depending on the stage, that's why we keep saying, please get up and get screened and pick this thing early if it is there. Because the drugs you use in some of them and the kind of surgery you do, they are not compatible to good sexual relationship. Some of the surgery will involve removing a significant part of the vagina. You find out in one way or the other, it's going to compromise the lady's ability to enjoy sex. Some of the drugs, like if you do radiation, can affect the ovary, affect the activities of the ovary. The woman can be wet. It can't really be in a position to enjoy sex. But if you have these things early, if you discover the cancer early and do the treatment early, normal sexual activity will be there. That is it about sex. And of course, the good news again is that even if you have an advanced one and your sexuality is compromised, there are ways. If you discuss with your healthcare provider, there are ways you still can enjoy sex. For instance, not every sexual activity is insertive sex. You must not insert, the man must not insert his phallus into the woman's vagina. These are the things the healthcare worker can teach the woman. So don't lose hope. No matter the stage, you still can. There's something can still be done. About fertility, if the type of treatment is that the uterus is removed, of course, the woman can't have baby. Again, this underlines the thing we keep saying about trying to prevent this disease. If you catch the disease early, there are some forms of treatment that you can do, especially if you want to have baby, that will conserve your uterus, conserve your ovaries if you pick it early, and you still can go on and have children. These are the things you must discuss with your doctor. But first, ensure that you make your diagnosis early, that you don't get to the stage of having all these very bad symptoms before you present to the doctor. So that is the effect on sexuality and fertility. We're now talking about myths and misconceptions. These are the things that people erroneously believe about cancer of the cervix. These things are so misleading. So many people have died believing those things, And some of these things are one. People say that cancer of the cervix is not curable. It's not true. It's very curable, like we said in the previous episodes. The important thing is to pick it early. If you pick it early, it's completely curable. No residual effect. Of course, some say it's not preventable. You can. That's the thing we've been talking about. If you take steps, look at those modifiable risk factors, you can prevent it. Some think it is contagious. You can get it by touching somebody or something. No. Some even think it can be sexually transmitted. No, never. This is purely non-communicable disease. And again, some think it only happens to prostitutes, women who are promiscuous. No. Anybody. Like if you have non-modifiable risk factors, like you have a family history, you can get it. So it's not always related to sex. But sex, of course, is key. And some think that once you have human papilloma virus, you will have cancer of the cervix. Again, this is not true. Human papilloma virus, there are over 150 types of it. And in fact, for cancer of the cervix, only type 16 and 18 has been fully implicated. It's only about 13 other types that cause cancer of any kind. And some think that this cancer affects women who sleep with married men. Very funny things people talk about. So it's not true. It has nothing to do with that. God decides on which kind of punishment to give people, but it hasn't been proven that God gives people who sleep with married men cancer of the cervix. So these are myths. Some people think that you can get it through witchcraft. They say they project it and all that. So because you get it through witchcraft, you must treat it through witchcraft or herbal means. They tell you the kind of leaves or the kind of traditional medicine meant to go. No. And if you're going through other routes, you find out you're delaying. Remember, early diagnosis and treatment is key. So don't believe any of those things. It's purely scientific and the remedy is there. You only need to reach out for it and apply. Some think it only runs in family. Once your family, nobody has it in your family, you won't get it. No. What of the other risk factors? What of the other modifiable risk factors? You might be exposed to it. You don't get a human papilloma virus, which causes up to 95% of this disease through family history. So no, it's not, And then some other people wait for symptoms before they come up and then complain about it. No. And we've said that once you start getting symptoms, it's a bad sign. Remember, we talked about carcinoma in situ being quiet for 8 years, and it's giving you all that time to see it and take it off. It's in situ, it hasn't gone beyond the cervix. And once you take off that cervix, you're done. But if you wait for it to start giving you symptoms like all those abnormal vaginal bleeding, painful intercourse, and all that pain, then it's bad. So don't wait for symptoms. Then the last one we talk about in this misconception, people think it's only for old women. No. Remember, in our previous episodes, we told you that the age range, peak age range is 25 to 45 years. So it's not for old women, and that is why. And remember, we said even WHO advises that you start screening from 21 years. Between 21 and 25, you go on screening. So it's not disease for the old women. In fact, the elderly from 65 years, if they haven't had cancer of the cervix, it's unlikely they will have it. So these are the misconceptions you must guard against. Don't let those things, sway you. Again, our message from the Community Positive Health Attitude Initiative. Cancer of the cervix, very preventable. All you need to do is to make efforts to pick it early. Pick it early. And you can pick it early by screening. You go for screening, do pap smear. Then, of course, the other thing you can do to prevent it is that you take vaccination, human papilloma virus vaccine, and then you're protected. We keep telling you how much we love you. That's why we are making this effort. We love you deeply. Certainly your loved ones, your spouses, your family, friends, they love you. And we all want you to be alive. There are still so many things you can do for humanity. So many things. And there are still so many things to enjoy. Do not sit back and say it's not your portion. It can be anybody's portion. Get up and get screened. Take the vaccine. So that is it. We love you and we say thank you for watching. Thank you so much.